so neat seeing this event that I always really love and hold close to my heart, getting transitioned to a virtual event. So great job, peoples. And so, yeah, today we're going to just kind of have a conversation about some reproductive health policy things that are happening at the state level, and a little bit at the federal level as well, both in the state legislature and the State Board of Education, and also some super easy ways that you can get involved and become an advocate literally with a few clicks of your phone or your computer. And so, Selena, I'm going to let you introduce yourself. Oh, and I should say, I'm Jem Bando, and I am Director of Policy and Data for the Texas Campaign to Prevent Teen Pregnancy. And Selena, I will let you introduce yourself as well.
Hi, everybody. My name is Helena Mostajabian. I'm one of the adolescent physicians at People's Community Clinic, and happy to be with all of you tonight. And thanks for joining us.
All right, and next slide, please. All right, so before we dive into the actual presentation, I would like for everybody, there are two ways that you can do this. I just dropped the link. Oops, I just sent it directly to Stephanie. Let me send it to everybody. You can either pull out your phone and you can try and snap a photo and open up the website that your phone will open and go to this website, or you can click the link that I just dropped into the chat box. And this is going to tell you who your state representative and your state senator are. So everyone take just 2 seconds to do that. It should be nice and quick. And then when you find it, please drop your state representative and your state senator into the chat box. And Stephanie, if you would flip to the next slide really quickly, this will be what you're seeing. And so we're looking for your state representative. It'll say Texas House District, and you're looking for your state senator, Texas Senate District. And maybe flip back in case people are still getting to the website. And then just type those names into the chat box. So I'd love to see where everybody is from. All right, so I'm seeing an Austinite with Senator Eckert and Representative Israel. That's my senator as well. Senator Eckert is interesting because she is sponsoring one of the bills that we're really excited about. Paige, you must be my neighbor. We have the same members. I'm not going to ask you if you knew these people before you actually did this. Regina, I know you're my neighbor. Oh, and then Kelsey, you live down south. Eckert, yep. Yep. Seeing a lot of Central Texas folks. So everyone keep on doing that. Make sure you have your members, because at the end of this presentation, keep that link open on your phone or your computer. We are going to have the option of actually sending these people an email and telling them exactly what they think, what we think about some bills that we're working on. All right, so hold this thought and we will come back to this at the end. All right, so I will turn it over to the doctor. And you're on mute.
Sorry, guys. So, I wanted to give a quick overview of why is sexuality education so important for our teens. And probably what you've heard, like much of the conversation is usually focused around unintended pregnancy and STDs. However, the spectrum and implications of sexuality education are much broader than that. But it may be, but those implications may be more difficult to measure, which is why we don't hear about them so much. So, the ultimate goal is to raise teens and adults that have developed a positive and healthy sexuality. But by that that includes a safe and positive view of sexuality. It includes reducing risk of unintended pregnancy and sexually transmitted infections. It includes recognizing unhealthy exploitative relationships, and ultimately to allow our teens and young adults to make informed decisions and that are positive and healthy for them and safe for their bodies. And we know that unfortunately, lots of teens tell us that they've had negative experiences as their first sexual experience, and that carries into adulthood. It has to do with consent. It has to do about how they feel about their bodies, about their self-confidence. So it's really, really important to get this right from the beginning and have the cornerstones right. So sexuality education, again, it goes much, much beyond just the physical aspects, the physiology, the anatomy. It involves discussion of cultural, psychological, and spiritual dimensions of sexuality. And we want to make sure that other than covering the basic medically accurate information, we also talk about feelings, values, attitudes, and as well as communications and decision making skills when we're discussing this topic. But in terms of like the very, very basic, minimum of what sexuality education should include, we want to make sure that includes accurate anatomy, gender identity, sexual orientations, general information about relationships and intimacy, reproduction and contraception, STIs, and a really important topic is reproductive rights for healthy children, as well as those who have disabilities and those who have chronic medical conditions. That doesn't get talked about much, but for example, we have a significant portion of our patient population that have disabilities or have chronic conditions, and we do our best to have special conversations with their families through our health educators and medical providers to make sure that they are comfortable with their children's sexuality and that their children are comfortable with that. We go to the next slide, please. So that's the ideal. However, the reality is a bit further from that. And as you can see here, over the past 20 years, really the percentage of high schools that have discussions about any multitude of these sexuality topics has decreased instead of increased, and we can see that in our patient population, unfortunately, where ideally you don't want just school or just the clinics to be where people get their information. You want them to get their information from a variety of areas. So clinics are important, schools are really, really important, families and communities are also very, very important, because that's where kind of patients spend a lot of their time. And we know that increasingly most of our patients are getting their information from their friends and from social media. So it's important to point them to accurate resources.
All right, well, thank you so much. And so if you go to the next slide. So to kick us off, we are going to dive into some important updates that we have around sex education at the state level. So in the last year and a half, a lot of folks who work on sex education in Texas were eyeballs deep in revisions of the minimum curriculum standards that guide sex education in Texas. These are called the Texas Essential Knowledge and Skills, or the TEKS. And so for the first time since Titanic was in the movie theaters, Texas has new sex education curriculum standards. Um, this is really important because this will impact the health education that all of the 5 million plus school children in Texas will receive. The state is currently in the process of reviewing the actual instructional materials, the textbooks for these new standards. And then in the following year, in the 2022-2023 school year, we'll actually start delivering these new standards to students. So if you don't know what the State Board of Education is, you're not alone. Most people don't know what this is. The SBOE is an elected body made up of 15 members. They represent huge districts, about 2 million people in each district. And at the time that these new standards were adopted, it was 10 Republicans and 5 Democrats, so a very, very conservative body. It's since flipped to 9 Republicans and 6 Democrats, so a little bit of electoral change, but still a very conservative body. which is one of the reasons why we were actually very pleased by the final standards that we wound up getting. So if you go to the next slide. All right. So again, these are the minimum curriculum standards for health education. School districts can go above and beyond these standards, but this is the floor. This is the bare minimum that school districts are expected to provide for their students. So these new standards are a big expansion of the old sex education and health education standards that we adopted back when Leonardo DiCaprio totally could have fit on that door, and I'm still sore about that. So what do the new standards include? So we've got the kind of nuts and bolts information on physical health. So topics like puberty, menstruation, anatomy, the systems of the body, including the reproductive systems, and the process of human reproduction. And these new standards are very greatly expanded from prior standards. We have things that are really crazy, like timely information about menstruation now. We actually will teach kids about menstruation before they're likely to actually start menstruating. So we're calling that basic nuts and bolts information about how your bodies work a good thing for our kids to have. The new standards will now teach all Texas school kids basic information about contraception, condoms, and the prevention, screening, and treatment of sexually transmitted infections. Again, this is a big expansion and a big improvement on our health education curriculum. And the new standards aren't just about physical health. They also have a lot of very good language about healthy relationships. So things like healthy communication, things like prevention of dating violence, prevention of sexual assault, sex trafficking. And while the new standards um, don't offer everything that we want in healthy relationships, they do include language on how it's important to respect the boundaries of other people. So the prior 1990s standards only talked about teaching kids to refuse sex. But now the new standards recognize that it's also important to teach people to accept the refusal of other people. We think that's a big step in the right direction. The most important thing of all about these new standards is that the really important information is now offered at the middle school level. So in Texas, health class is required at the elementary and middle school level, but it's an elective at high school. So that means that a lot of high school students choose to not take health education, and a lot of school districts don't even offer it at the high school level. So even if the student wanted it, if they were in one of the smaller or mid-sized districts, they might not even have the option of taking it at high school. But everybody has to get it in middle school, which means in theory, all Texas students should get at least basic sex education. That is a victory. The standards aren't perfect, and we'll talk about that in a second. But I want to take a second to celebrate the fact that we can expect all Texas school children to get some basic medically accurate information about how their bodies work. All right, next slide. All right, so now that we've celebrated the good news, this is the kind of not so good news. So while we talked about how the new standards do include information on respecting the boundaries of other people, they don't actually talk about the concept of consent outside of a very narrow kind of legal definition around the age of legal consent. We had the language about consent in those standards for a while, and the elected officials decided that they weren't comfortable with that language about consent. They thought it was teaching kids that it was okay to be sexually active as long as consent was there. And so they chose to remove that language. There is also no acknowledgement of the needs of LGBTQ youth. In fact, the standards don't even acknowledge the existence of LGBTQ youth. There were a lot of people, a lot of youth, a lot of advocates who really passionately advocated for addressing the needs of these youth. We even said, could we at least have language on the importance of preventing bullying of LGBTQ youth, because we know this is creating serious mental health concerns. That did not happen, so that language is not in the final standards. But going back to the good news, again, these are the minimum standards. So any school district in the state has the option of teaching above and beyond these standards and offering information on those additional topics like inclusivity, like the importance of consent. So we're saying that, there's the floor, but we want to We want to encourage districts to go a little bit higher than the minimum. And again, that was a lot of information. So if you have any questions or comments, please feel free to drop them in the chat box. All right, and next slide. All right, so what does this mean now? We have these new standards that are actually pretty good. What are we going to do with them? So these new standards will go into effect in the 2022-23 school year. And again, they're the floor. Districts still have the option to teach beyond the floor. And we need local advocacy at this point. We've got the standards. Now begins the long, hard work of putting these standards into place. And anyone who's interested in sex ed or believes that sex ed is important has a role to play in this. So what can you do as an advocate, as a clinician, as a youth, as a parent? All right, so the most important thing that you can do is reach out to your school board and let them know that you support high quality sex education. You can let them know that you support teaching content that's inclusive of the unique needs of LGBTQ youth. You can let them know that you support teaching youth about the importance of consent. So Texas has some very complicated legal frameworks around the way that school districts adopt sex ed. It starts with a school health advisory council, and then the school board is the one who adopts it. So the school board members need to know that their parents support this. But we do have these advisory councils, which are called SHACs, and they're volunteer groups. They're made up of parents in the district. They're made up of community members, doctors, clergy, educators, all the people that might be interested in advocating for student health. So if this is a topic that you're really passionate about, or you might have a lot of expertise in, consider finding out how to apply for the SHAC in your local school district. So we know that school districts like Austin are already approving very progressive sex ed. If you're in a smaller or more rural school district, your voice becomes really especially important. So if you need any help in learning more about that or finding out what that means or what that process is like, you can reach out to us, you can reach out to Cardia. There are a lot of people out there that are willing to help you on this. All right, so if you have any questions about sex ed, I know that was a lot of information in 8 minutes, so feel free to drop questions in the chat box. But otherwise, we will shift gears and talk about the legislative session. So the Texas legislature meets every other year in odd numbered years. They come to town in January, they go home in May, and in between, they have to pass the state budget for the next 2 years. And anything else that they can do is what they do. I've been around the legislature for a lot of years, working in the legislature, working as an advocate, working as a journalist. By far, this is the weirdest legislative session that I have ever seen. And I talk to people who are a lot older and more experienced than me. It's the weirdest session that they've ever seen. It's a really bizarre legislative session. So we're in the middle of a public health crisis. We started the legislative session really slowly because of this public health crisis. They came to town, they went back home again, they came back, the entire state shut down for a week for a snowstorm, they left, they came back. And so really in mid-March, we're just now getting to the point where actual work is getting done. And all of a sudden, everybody's frantically trying to get their bills heard and get their bills moving. A lot of the advocacy is happening remotely. Some of the hearings have some remote options. There's a big tent set up outside of the Capitol where you can get your COVID swabs before you walk in the building. It's a very interesting session. But even though it is very, very unusual, there is still a huge need for advocacy. And the good news is that because we are in more of this remote environment, people who either may not live exactly in Austin or people who may not be able to take a whole lot of time off of work to go to the Capitol actually are seeing that they have a lot more access to lawmakers and to committees. So the silver lining of, this global pandemic for our advocacy is maybe you have a better chance of getting involved. So one more note about this session, we did not see a lot of electoral change at the level of the state legislature in November. We thought there might be a big shift. There really wasn't. And so what we're seeing kind of in response is a lot of partisanship. If we see electoral change on either side, the party that lost tends to move a little bit more towards the middle. That didn't happen. So we really are seeing a very highly kind of partisan session. All right, so next slide. All right, so now I'm going to talk about a couple of specific bills that are very important for adolescent and young adult access to contraception in Texas. And these are bills that the Texas campaign is working very closely on. And we would love the support of anybody in this session who might be interested in advocating on them. So the first bill is about contraceptive coverage in the CHIP program. This is the Children's Health Insurance Program. And CHIP provides full healthcare coverage to children whose families earn a little bit too much to qualify for Medicaid, but they're still considered kind of low to middle income. So CHIP is a really great deal for the state. The federal government pays about 75% of all the services that are provided through CHIP. The state only pays 25% of that. That's even better than Medicaid. So if we want to provide services cheaply to our kids, CHIP is a great way to do it. CHIP covers full health care for a few 100,000 Texas kids, but with one big exception. Next slide. So Texas is one of just 2 states that doesn't cover birth control in CHIP, the other state being North Dakota. So in Texas, you have to show medical need for birth control. So if you have a medical condition that would be treated with, say, oral contraceptive pills, that will be covered by CHIP if you jump through a lot of hoops to get it authorized. Otherwise, if you just don't want to get pregnant, CHIP will not cover your birth control. We send teens to another state-funded program that is 100% funded with state dollars with 0 federal dollars, which is a bad deal for the state. Sometimes teens can make their way to a Title X clinic, which is a great way for them to get confidential services. And sometimes they just don't get the medical care that they need. And in fact, if you go to the next slide, we issued this research report on contraceptive coverage in CHIP just a couple months ago. And in this report, we looked at some data from the state, and we found that among teens who were enrolled in CHIP in 2018, by the next year, about 1,600 of them had experienced a documented pregnancy, most of which were covered by pregnant women's Medicaid. So what we're seeing is a real need for these services. This is not, a kind of made up problem. We have a real need to be providing these services to our Texas girls. So State Representative Donna Howard, who may have come up in some of your Who Represents Me searches, she's an Austin representative, she has filed House Bill 835. And this bill would add birth control as a covered benefit in the CHIP program. We had movement on a very similar bill last session, and we found that doing this would actually save the state money because we'd be preventing unintended pregnancies. So good deal all around. And what we're trying to do right now is get this bill a hearing in the Public Health Committee. All right, now you can go to the next slide. All right. So the next bill has also been around for a few sessions, and this is on consent to birth control for teen parents. So if you were in the last session with the YAC leaders on consent to birth control, you know that Texas makes it very challenging for teens to consent to their own birth control. We do this even if the teen already has a baby. So in Texas, if you've got a 17-year-old mother, she is the medical legal consenter for her child. And if her baby needs heart surgery, she can consent to that heart surgery for her baby. Under state law, we don't allow her to consent to her birth control. We need her parents' consent, the baby's grandparents, to consent to the birth control. Perhaps not coincidentally, Texas consistently has either the highest or the second highest rate of repeat teen pregnancy in the nation. So when we look at the teen births in Texas, about 1 in 5 of them are repeat birth, meaning the teen already has at least one baby. So our organization thinks that we should allow people to access the healthcare that they need. If we've got a teen parent, it's really imperative that we allow them to prevent future unintended pregnancies so that they can focus on the family that they currently have and give their family the best start in life. We also have a glitch in state law where we allow minors to consent to care related to their pregnancy or childbirth, because obviously we need to make sure that people can access prenatal care and delivery care. But whoever wrote this section of state law, I think they probably didn't have a uterus because they wrote the law in a way that at the moment that the baby emerges from their body and they're no longer pregnant, the teen loses the right to consent to care. So we don't allow teens to consent to postpartum care. We think this is just a glitch. It's badly worded law, so we're also trying to fix that. So let's see. We have a question from Angelica. Do the states that cover birth control under CHIP cover it for all people with uteruses or just folks who identify as young women? It is anybody with a uterus. So states, especially like Texas, are not particularly progressive in the way that they identify gender. So, you know, any kind of care that they provide will be identified as care for women or men, regardless of how that individual actually identifies. And if you go to the next slide. All right, so this is a summary of the 3 bills that we're working on currently. HB 296 and SB 536 would allow teen parents to consent to contraception. And then HB 3369 would allow all minors to consent to birth control, not just parents. And so if you go to the next slide, we're going to shift gears just a little bit and talk about some federal policy for a moment. So we've talked a little bit about the importance of Title X clinics. So Title X is a federal funding stream. It's been in existence since the 1970s. And it's kind of the most secure and important funding stream outside of Medicaid that we have for providing access to reproductive health care, contraception, some basic preventative care services, and other kind of critical care. It doesn't fund abortions, and it's especially important for teens because it offers confidential reproductive health services to teens, which Texas does not protect under state law. And across Texas, we have about 100 Title X clinics. So we've had some instability in our Title X program. So the Trump administration implemented what's called a gag rule. And so the gag rule would prevent medical providers from referring patients to abortion providers, even if the patient was asking for that information. And then there were also some very stringent requirements that would require kind of physical and financial separation of providers from abortion facilities. And so this resulted in a big exit from the program by providers such as Planned Parenthood. We saw a big decrease in the number of Title X providers nationwide. So what's happening right now? The Biden administration came in, and within a few days of the inauguration, they announced that they would review that gag rule and the other rules about Title X. So just in the last few days, they announced that they are going to review this rule. They expect to revert it to what it was prior to the Trump administration, and we'll have new rules by late fall that will be into effect by the end of the year. So again, we don't have a final, we don't have the new rule yet, but what is kind of widely expected to happen is that these Trump administration rules on the gag rule will be reversed. And that means that other providers will be able to re-enter the program. And let's see, we had one question. Have bills like SB 536 been attempted before? Yes, absolutely. We got the teen parent consent to birth control bill successfully passed out of committee last session. The opposition that we tend to hear around bills is that there's a fear that allowing teens to access contraception would make them more likely to have sex, even if they already have a child and clearly have been sexually active and clearly are at a high risk for a future pregnancy. We have a lot of research saying that that's not true. The research is very clear that providing youth with access to birth control does not make them more likely to be sexually active. It just makes them less likely to experience an unintended pregnancy. But it can still be a hard sell in the legislature. All right, so we've got 10 minutes left. I'm happy to take questions, but what I would like to do now is provide people with the opportunity to reach out to their legislative members. And if any of the bills that we were talking about today, you know, were really interesting or exciting to you, it is extremely easy to let your elected official know about that. So I am going to drop this text into the chat box. And so either in the next 10 minutes, or if you want to take more time with it and kind of think about it and craft your story, at some point in the next day or so, um, I want you to reach out to your elected official and let them know how you feel about these. So if you go back to that Who Represents Me and you click on the name of either your state senator or your state representative, it'll take you to a page where you can fill out a form to email them. And so if you want to write about the teen parent consent to birth control bill, you would pick HB 296 for your um, for your state representative, or you would pick SB 536 for your state senator. If you are more interested in contraception in CHIP, you would pick HB 835. And that one only is in the House now. So both of the House bills have been referred to the Public Health Committee, and then the Senate bill has been referred to the Senate Health and Human Services Committee. And this is some easy cut and paste text. If this is something that you just want to grab and go, you can do that. But you might have a personal story. You might be a teen who struggled to access these services. You might be a clinician who's trying to help your patients. You might be a parent who wants your kid to have reproductive health care rights. So it's really great in any advocacy outreach to include personal stories that really brings all of this to life. And if anybody actually is able to get their email out, let us know in the chat box. Let us know who you emailed. Do we know if condom demonstrations or condom distribution in AISD's shack has been revisited? So I'm not directly familiar with that. State statute actually specifically has language preventing condom distribution. That's actually in our state law. So I'm not sure if they came up against that, but I'm not super familiar with the exact things that the Austin ISD Shack is doing right now, especially in the pandemic.
I don't know, Angelica, if they've revisited that again. It's fun, Jen. It's funny, Jen, that you mentioned that. Because the way that that law is worded is that it says,
Yeah, yeah.
a state cannot distribute condoms in connection with instruction on human sexuality.
Mhm.
It doesn't say they cannot give out condoms.
Yeah.
Period.
Right. Well,
And so I know I brought it up in the shack years ago, and I'm sure people have brought it up. But as far as I know, they're not moving forward on that yet.
yeah, we had brought it to the shack
Yeah, and
4 years ago, something like a long time ago. But then when they did the revision for the sexual health and AISD specifically, and AISD says they can't do demonstrations. But yeah, we did cut. There's a little bit of a loophole there, which we took a little bit of advantage of. But yeah,
it's. I don't think it's in there. It's not in their policy that they can't do condom demonstrations.
Yeah,
That's
no,
not
right.
in the law.
It's distribution. Yeah.
Yeah, it's just distribution. Demonstration is nowhere in the law whatsoever.
No,
And
on AISD, they told us that we couldn't do.
Well, and that just depends on what their local policy says about it. And I don't remember seeing that in their local policy. So it may just be if it's not addressed, then they don't want to do it. So that's a different thing.
Yeah, no, we can do where we can't even show them a condom. So we could do where if it's on AISD property, we can't show them a condom. We can't do a demonstration. We can't distribute. We can show them a picture and tell them how to use it.
So that's a local policy that Katie is saying in the chat box that they've prohibited it in their local policy.
Right. I was just wondering if anybody. I haven't gone in a bit to a shack meeting. I got a little burnt out, but I was trying to see if anybody else knew there was any movement on that. Right on.
That's a great question from Dr. Neville. What do some of the adolescents and young adults think about all this? Take yourself off mute and let us know.
Yeah, you've got 4 minutes.
do any adolescents or young adults want to comment on hearing all of this?
So I'm wondering if we can actually, we always talk about to our patients about, voting and registering to vote and getting involved with having civic engagement. But we don't give them specifics about like these topics that could impact them. So anybody who has great ideas about how we can incorporate this to the clinic, about how to contact the representatives and what are the issues that are being discussed, I think that may be an area that we can work on as well.
Yeah. And I was going to say, Texas Wears Condoms is one of my favorite websites now. It's so colorful, engaging for learning.
I've not heard of
Yeah,
Texas.
they're a little hit and miss sometimes though with being able to order from them. Some of the kids, one time they were like, Miss, we got some condoms in, we ordered, but they were like super small. I was like, oh no, why? It should be a regular size condom, but I didn't get to see them, so I had, take their word for it. I don't know.
Oh my God, are those blue bonnets on the package? That's adorable.
Well, I find that with the conversation, I think it's really hard for, at least for the adolescents and young adults I see, when they only get information in middle school. Like their brain is just like in this whole other place, and it's still very awkward and hard to put things together. So we're definitely finding the youth do need a lot more education. So we're starting with them getting introduced to the health educators during puberty as they have pubertal changes. And then we're hoping that relationship will build over time with everyone's comfort level to get more and more education. But it really has been challenging when a lot of the language and the words aren't there for the youth that we see.
Yeah, and we're really hoping to see more high schools offering high quality sex ed. It's great offering it at middle school because it means that everybody can access it, but we know that information, can be a lot more resonant when you're a little bit older.
All right, everyone, it looks like we are right at about time, or at least 1 minute till. So I just wanted to take this time to thank our speakers so much for being here and for sharing this amazing information with us about sex education at the state level, bills, advocacy, all of that good information. If you are a parent, even more important to get involved in your school district about it, or tell your elected officials that you are also a parent, and that really helps out as well. But thank you all so much for being here, and thank you for the great information.
Thank you so much.
Thank you, guys.
Thanks, Jen. And Felina.
Thank you.
Okay, so where do we go now? I'm like,
oh, I should have said you can go back to the main. I should have given a little wrap up. You can go back to the main room for the next 10 minutes for, let's see, let me find my agenda there. You'll have a about a 10-minute break usually. Yep. So 10-minute break, networking break. You can go to the main room, and then the next session starts at 7:40, and you'll have a different link to go to those two sessions at 7:40.
Thanks,
More.
Stephanie.
stay here.
Hmm?
I'm so tired.
Yeah.
I had an appointment doctor's appointment at 7 this morning, and I'm just like,
yeah. I get it. Oh, good to see you too, Eleni. You're probably already gone. Okay. Is that it? Oh, I'll stop sharing. Sorry.
Yeah, you did great. Thank you so much.
Thank you.
That's awesome.
I have a really hard time knowing my place, and what that means is sometimes I'm a moderator and I'm like, oh, but I